In this video, we're going to discuss the anatomy, likely history, differential diagnosis, management of plantar fasciitis. The plantar fascia is a thick connective tissue, also known as an aponeurosis, which supports the bottom of the foot. It runs from the calcaneal tuberosity, the calcaneus being the heel bone, towards the head of the metatarsal bones. Plantar fasciitis is the most common form of heel pain, so it's really important that you know a little bit about identifying it. So NICE says that characteristics of plantar fasciitis are an initial insidious onset of heel pain, intense heel pain during the first few steps of walking, and that the pain reduces with moderate activity, but that the pain worsens during the day or after long periods of standing or walking. On examination, you might find tenderness, particularly on palpation of the plantar heel area localized around the calcaneal tuberosity. You might have a limitation to ankle dorsiflexion with the knee in extension. You might find that you have a positive windlass test, which is reproduction of the pain by extension of the first metatarsal phalangeal joint. You might have a tightness of the Achilles tendon, because these tend to be linked. And they might have an antalgic gait, which means abnormal walking to avoid the pain. Differential diagnosis that is important not to miss are Achilles tendonitis, which will present more with pain along the Achilles tendon and will be exacerbated by the Simmons test, squeezing the calf, and a calcaneal stress fracture, so a stress fracture of the heel bone, which is common after somebody's been on a particularly long walk carrying a heavy pack and having an increased load through their heel bone. Differential diagnosis is suspected and you're not sure that it's plantar fasciitis. It's important to refer appropriately to either podiatry or to orthopedics. Management of plantar fasciitis is mainly conservative. So it begins with reassurance that most people will make a complete recovery within the first year. If people are struggling, then they can apply RICE, so rest, ice packs, compression, and elevation, particularly the ice packs. Simple analgesics such as ibuprofen, analgesia gel, or paracetamol might help. And then in terms of self-care advice, you want to rest the foot, you want to wear shoes with good arch support, and perhaps think about purchasing insoles from a podiatrist. And similarly, avoid walking barefoot because this does not support your arch well. And if the patient is particularly overweight, then you want to consider suggesting for them to lose weight. If the symptoms continue or it's providing really bad short-term problems, you can consider an injection into the plantar fascia with a corticosteroid, but this is rumored to be really, really painful and may only last for a couple of months before symptoms return. A few quick questions at the end to summarize your knowledge. If you can identify the calcaneal tuberosity on yourself and then identify the plantar fascia and where this would run. What would be the common history of plantar fasciitis? What would you look for on the examination? And what are the key steps in conservative management?